Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
Hello and welcome, dear students. And anatomy series is going on, as you know. Today we'll be dealing with very important two topics, which have been actually the reason why you've been requesting me for taking anatomy series in the first place. Today we'll be talking about the anatomy of bladder and that of ureter. I've tried to include good pictures as much as possible to tell you about the anatomy of bladder. I'll try to hold physically as well. Try to tell you how the relationship of the bladder is in the pelvis, and I'll also try to use certain videos which I've got from the net to in order to tell you the relationship and the complex anatomy of the ureters, which we all gynecologists we dread. Before we get to this video, there are certain important announcements I'd like to make. Complete course is going to be updated very soon, and updation means it's not just going to be one or two topics, it's going to be entire course update. That means all those topics which you would be requesting me to take separate notes on. There was a couple of students who wanted more of notes, there were some of them who wanted more of videos. I have encompassed both in the new schedule of my complete course. So, guys, all of you who are now preparing for the June theory exam, it's high time you should now concentrate, on your theory properly. Go through all the important details. Like in my notes, they're mostly very crisp. They are up to the point, and they are the other ones in which you cannot miss them if you want to crack the theory exam. So you have to go through at least that part which I have given in my notes. And of course, I've got my answer bank. That is the second announcement. The answer bank has been updated. The December 2022, that is this December which has gone. That paper has been now updated in the answer bank, and it's already there available to be purchased. The students who've already taken my answer bank before will automatically see their updation in their respective apps which they've already subscribed to before. So they'll automatically, it will get updated. That is the advantage of taking it beforehand. So these were two important announcements to be made. The others, there's one more announcement. Third and most important, the vaginal hysterectomy has been the workshop has been now completed and updated on the app as well. So all those students who were there with me for the live classes in my Telegram channel have already mostly seen all the videos. But the ones who missed it, the ones who did not know that there is a vaginal hysterectomy going on, well, you can go ahead and purchase it. It's available in my app, and rightly so, because the videos are fantastic. I'm very proud of the way certain videos I have borrowed, but certain videos are my own, from my own OT, and they're beautifully given, giving you and delineating each and every plane. So please go out and learn yourself, because you have to be a surgeon one day, and nobody will give you any marks for being a lousy surgeon. You'll get into more of trouble. So when you have to learn, you have to do, you might as well do it right. And for that, you need to see right and learn right, and only then you'll be able to do it. So let's now proceed forward with the video today. So you can see right now is a little bit of about the urinary bladder. Now, urinary bladder, the things you already know, I'm not going to tell you again. It's a triangular organ, it's a hollow organ, it's a right behind the symphysis pubis. So I've made this kind of balloon. If you remember, I had taken in a video which described the relationship of ureters with uterine artery, which is there currently also there on the YouTube. Please go ahead and check it out. It's a very very important video. I'll give the link in the description. Just go ahead and check it out, because it's a very important video to be seen to understand the relationship of ureter and uterine artery, which is not the agenda in this video currently. Right now, I'm going to be focusing more on the anatomy of and the relationships of the ureter with the surrounding structure, and of course the bladder with the surrounding structure. So if you consider this balloon as the bladder, then I'll tell you what exactly happens. Of course, it's got a capacity to have urine filled inside. On 100 ml capacity, the first wave, it goes to the brain that you have to now think about voiding the urine. And the capacity 300, you are uncomfortable, you want to micturate, and you do usually between 200 to 300 ml. And of course the the maximum capacity till 500 to even 800 ml of urine. So of course that will be too much distension, and obviously with a lot of discomfort. So now let's see first and most important, the parts of the bladder. They're divided into a base and a dome. So if you see why I've taken this balloon is that I'll put it up close. It's actually kind of triangular, shape. This it becomes the superior surface, okay, or something like a dome. Okay, over here you have the attachment of ureters coming. Okay, here the ureters, they attach exactly like this. So this becomes more of a base, okay, at the level of ureteral orifices. And these two, they are infralateral surfaces. They are infralateral surfaces, and this becomes the apex. If you can see, this is the apex. So how it is usually there in the pelvis is something like this. This is the pubic bone over here. This is the pubic bone. So it's right here. The apex is right here. Okay, and this is where the pelvis is actually pretty small. So I'll now try to show you. So this is where, here is where the two ureters are attached. If you can see it, yeah, somewhere over here the ureters are attached. So they come from here, but they go like a bowl and they attach over here, correct? And the ureter and the apex, this apex is right close to the pubic symphysis, as you can see over. And this space, can anybody tell me the name of this space? This is called the space of Ridgius. Just retropubic space, or the space of Ridgius. Why is it important? Is because so many operations that we do, the sling operations, the operations not for the prolapse, but to correct the urethrocoel if at all, or to improve the stress urinary incontinence, they are done in this space. Okay, so I'll be dealing with those operations also. In fact, one of my lectures I have spoken about these operations. But yes, of course, these are the certain few operations that you do to correct the urethrocoel, or to improvise the stress urinary incontinence. You move in that space, the space of Ridgius, or the retropubic space. So what I was trying to tell you is that this is the bladder, this is the apex, this is the infralateral surfaces, both the sides. Here is where the ureters, something like this. This is how they attach to the bladder. This becomes the dome, and this becomes the base. Now, obviously, you'll understand it automatically that, dome happens to be thin walled. This is the most distensible part of the bladder. Okay, this is the one which keeps rising. And what I was trying to tell you in this pelvis is that, see, up till now, the bladder is like this, it's a pelvic organ. It's a pelvic. But when it starts distending, it becomes like this, it's now the abdominal organ. And sometimes when you cut over here, especially low pheneal incisions that we gynecologists give, and if the nobody has put the Foley's, which is actually a blunder, you can injure the bladder while in your first cut, while you're cutting the peritoneum. Sometimes even in second cesarean sections, third cesarean sections, the bladder is so pulled up, because somebody has pulled up the peritoneum and stitched it, that the first time you enter the abdominal cavity, it has happened with me as well, that cutting the peritoneum, I was so very confidently cutting, and my cut was also not low down. See, the first incision that you give is low in the abdomen, and then you go a little higher when you're cutting the peritoneum. I was cutting high up, but the bladder was so pulled up that it didn't feel like I'm going to cut the bladder, but it did happen. It was injured, and it was a cut through and through, and then we had to go ahead and repair it. So this I'll talk about later for the applied anatomy, but right now just know that after it fills up, that's why you need to put Foley's. Um, After it fills, this is like almost a distended bladder, which you can see, which will be more like this. Then it will be like this in the cavity. Correct? It will be like here, mostly here. So what you do is, with the help of Foley's, you just deflate it and become something so unremarkable, something like this, and it keeps pushed over here. You can of course get more space to do your surgeries. So now let's go back again and understand the relationships of this bladder. So this is the place. See, otherwise it's like this, so the only place that can distend will be this, right, on the top. So this is what I'm trying to say. The bladder can be divided to base and dome at the level of ureteral orifices. The base of the bladder consists of the urinary trigone posteriorly and a thickened detrusor anteriorly over here. So this is mostly the base. What I'm holding right now is actually the base. And the other part which you can see above is actually the dome. So the three corners of the trigone, they are formed by the two ureteral orifices and the opening of the urethra into the bladder. It has got a sympathetic innervation and is responsible for maintaining the continence. So Sympathetic system has sympathy with you. It will not let the bladder void. Parasympathetic system is the one which lets the bladder void. We'll get to it later. So the dome of the bladder is thin-walled. It's the distensible part of the bladder above the bladder base. It's got parasympathetic innervation and is responsible for micturition. Okay. Now it's other part. This is looking like a apex, isn't it? So I've made it in such a way that it looks like an apex. This apex lies posterior to the upper margin of pubic symphysis, and right here between the pubic symphysis and the apex is the space of Rhyzius, in which you have those MMK operation. If you remember, I think I must have told you those kind of operations are performed here, so that there is this stress urinary incontinence or the urethrocoel or whichever laxity is there, that can be stretched, and you can have the patient can be improvised if at all there is stress urinary incontinence, proven stress urinary incontinence alone because of urethrocoel. Only then you have to perform such an operation. uh, so this is at the pubic symphysis. Lower pass is mostly the fixed part, neck, from which the urethra arises. Okay. Now let's see, you yourself are going to tell me the relationships. Of course, if you understand this anatomy, you will be able to understand the relations. It's not a big deal. What about the anterior part? If I ask you, anteriorly the bladder, what is the relationship of anterior part of the bladder? Answer is the anterior abdominal wall is related to the anterior part of the bladder. That's okay. You can even say pubic symphysis anteriorly, but anterior abdominal wall, right? Because when it inflates, it becomes like this. This is the abdominal wall, and this is your bladder. So when you cut over here and you go inside, you can rupture the bladder. Even when you're taking the peritoneum, right, do not take deep bites towards the lower part of your peritoneum. Okay. I think you must have seen my C-section workshop, and by now you guys are experts in doing C-section. Because at every step of the way, I think I've included all kinds of cesareans as possible. The breech extraction is there, twins is there, you have bladder dissection is there, previous C-sections is there, along with ligation it is there. I think only Patwardhana I am yet supposed to be adding. I'll add it pretty soon. Otherwise, everything is there. Difficult head delivery is there. Free floating head is there. Deep transverse arrest is there. Everything is there, and you need to learn these things, because sooner than later you will be performing these C-sections.